confronting this monster of COVID-19. We are happy that we are kept up to date, and we are not left to any guesswork. And Daktari, allow me really just to stress a couple of things. Number one, the fact that we are not out of the woods yet. And I think it's important for all of us to know that the statistics that are being shared are within context, or within a certain context, the context of sample size, and the context of other dynamics. But it's important that we continue to take very strict personal responsibility to help in this fight. And this applies really to all of us. Secondly, Daktari, let me appreciate the emphasis on UHC in your briefing today. Kenyans may want to know that right now the UN General Assembly 2020 has commenced. And because of this pandemic, it will be a UN General Assembly like no other. This is a landmark year because the UN is celebrating 75 years since its founding. But because of this pandemic, it is going to be largely virtual. Our president himself, a respected voice, a respected presence within the UN family, will be addressing the UN world virtually with the support of all of us for the full duration of the General Assembly. And while this goes on, universal healthcare as a key component of the Sustainable Development Goals will be at the core of the conversation for UNGA 2020. And it is therefore truly significant for Kenya, for Africa, and for the global community that Kenya continues to place universal health care at the core of our health service and at the core of government policy. And of course, this is one of the big four agenda pillars that has the full support of the President himself as a champion of this agenda. And I want to assure you, Daktari, that at the Ministry of Foreign Affairs, in our conversations during this UN General Assembly 2020, and in our interactions with Kenya's partners across the length and breadth of the globe, we will continue to place the agenda of universal healthcare at the core of our interactions with the rest of the world. Now, today, I come here on behalf of the Minister of Foreign Affairs to present it to you a donation from good friends, brothers and sisters of the state of Qatar. We received this donation on the 14th day of August 2020, a month ago. And I personally, on behalf of the ministry, received this donation at the Ministry of Foreign Affairs from the ambassador of the state of Qatar to Kenya. And as you have already enumerated, it is a consignment that includes a variety of equipment and supplies that will definitely go a long way in contributing to our war chest in this war against coronavirus. And you have correctly said we have 30 ICU beds, we have 3 ICU ventilators with humidifiers, we have 10 suction machines, we have 10 cardiac monitors of 5 parameter level, 6,000 N95 masks, 5,000 PPE overalls, 4,000 face shields, 200 5-liter alcohol sanitizers, and 200 infrared thermometers. This is equipment which we have no doubt will go a long way in increasing our capacity. And let me emphasize that a large percentage of this equipment and supplies were procured locally. Unlike other supplies, and previously yourself, Daktari, and me and myself received a large consignment from Slovakia the other day. We have received a consignment from India. We have received a consignment from China. And we have had a lot of our friends across the world coming to support. This particular consignment is special in the sense that it was largely procured locally. And this goes in line with the position taken by His Excellency the President to support local manufacturers and to aid in our larger agenda of manufacturing as a component of the Big Four agenda. And so, while I thank the State of Qatar for making this donation, I also further thank them for trusting the Kenyan producer, the Kenyan manufacturer, in procuring this equipment and these supplies locally. Dr. let me also take this opportunity to thank our Qatari friends for extending support to Kenyan nationals living in Qatar at the height of this pandemic. And the government of Qatar was able, through the Qatar charity, to provide food donations to Kenyans in distress in Qatar. And up to 2,000 food packages were received by our embassy in Qatar and distributed to Kenyan nationals there. The State of Qatar further worked very closely with us to fly back to Kenya our distressed Kenyans who are stranded in various parts of Qatar. And so we stand here really to celebrate real, tangible friendship and ties that bind between the Republic of Kenya and the State of Qatar. We thank you, and we also extend this appreciation to all our other friends across the world that have continued to stand with us during these challenging times. Once again, Daktari, asante sana.
Thank you.
Na tuko tayari kuendelea kuwapatia full support.
Thank you. Thank
na
you.
Nisisitize pointi moja ya kwamba sisi huwa hatupokei tu.
Naam.
Tunapokea, lakini sisi pia mahali tunahitajika kusaidia. Kenya has also been ready to help.
Fantastic.
Thank you very much.
Thank you. Thank you so much, Kasababu Namwamba. I think at this point we'll have some Q&A.
Good afternoon. My name is Purity Museo from KBC. My first question is in regard to before Kenya opened its borders to the international community, we were reporting few cases of imports of COVID-19. Maybe since August 1st, an update on whether we have any increasing number of imports of COVID-19 or not. And then number two, when you compare Kenya, or let's say Africa, with other countries, 7 months on, and still you're saying over about more than 70% of the cases are asymptomatic. Again, Cast this week you said that the kind of virus that we are dealing with is no different from other countries. Maybe you can explain why Africa is experiencing asymptomatic kind of the virus. And lastly is on the vaccine development. China has already started some human trial of its vaccine. Maybe is Kenya taking part in this? If not, do any efforts in also developing our very own? Thank you.
Good afternoon. My name is Robert Muirore Kangara from Kameme TV. My concern is about the COVID fund investigations. We understand that the 21 days given by the President are over. What do Kenyans expect? Thank you.
Beldin Waliaula from KTN. I wanted to ask about, we've said that from last week we've been recording less admissions in hospitals, less congestion in hospitals from COVID-19, but we've discovered that this week we have more people who are discharged from hospitals compared to home-based care. Why? And also, yesterday we recorded 10 deaths. The number is too high compared to now that hospitals are not congested, we have enough oxygen. Why are we losing more people still up to now?
Okay, I'm Haimba from Ebro TV. Maybe to Waziri Namwamba, maybe I would like to get maybe your comment in regard to Tanzania lifting the ban of the flights, Kenya and Tanzania. Maybe what exactly does it signify? And then maybe what exactly is the value of today's donation? And earlier on it was actually hinted that KEMSA is one of the parastatals that has been tasked of the storage of such facilities. Is it the same KEMSA that is storing the same facilities, keeping in mind that the same KEMSA is having a stock worth 6.2 billion Kenya shilling stock that is now lacking market?
Thank you. Thank you all for your questions. I'll start with the answers, and then I'll invite Kas Ababuna Mwamba to also add in some more information. Beldina wants to find out why do we have, a peculiar situation where we have fewer admissions, and yet today we've reported that most of our discharges are from hospitals as compared to the home-based care program, and why are we losing more people? Beldina, this is an important question, and yesterday Dr. Kuria was able to explain that when people are dying, for example, when we reported 10 cases yesterday, it was interesting to note that it was a new occasion where most of the cases were actually people who have no other known conditions, and that only 3 of them had comorbid conditions. What becomes interesting to note is that when you're studying the progression of disease and when you're studying outcomes from a disease, you do not, you're a human being who has many factors within yourselves. When we say someone has died from COVID-19, yes, that is what may be written in the death certificate, but remember, people may have other conditions, other statuses in terms of their body's immunological strength to fight COVID that contribute to that death. So it's not a simple matter of we lost 10 people yesterday and therefore yesterday was a bad day. These 10 people were in hospital for a varied number of days. Some people were there for 3 days, others had been there for a few weeks. And in that period, what we call the length of stay in a hospital unit, many things can happen in terms of your body trying to fight the condition and to be able to either survive it or succumb to it. And so every time we report, and what we are getting to is every time we report 2 people have passed on or 10 people have passed on, that measure in of itself alone should not be used as an indicator of how severe COVID is in the country. It is not enough. You need many other measures that you compound together to get a clear picture of how severe or how COVID is in terms of status within the country. But DG will be able to expound more on this issue. With regards to Purity's question, I appreciate the anxieties of, is really COVID different in Kenya compared to other countries? I think this is the question that is recurring every day. Is our strain different? And really we emphasize our COVID-19, when you look at its genetic makeup, it is very similar to other COVID-19 viruses across the world. So we are dealing with the same COVID-19. What, however, is peculiar is that there have been different evolutions of this disease in different countries. For one, Africa and Kenya have reported more asymptomatic cases. And the good thing is that studies are underway to find out, is there a peculiarity in Africa or in Kenya that offers some form of protection when it comes to COVID-19? And one of the most likely hypotheses, and we were discussing just this today with Kas Ababu, is that Africa and Kenya is filled with a younger population. We are young as a continent. If you look at our population pyramid, it is absolutely different from that in the Western world. And because we are young, it means then there's that protective effect of being young, having a younger population, and therefore not seeing the high mortalities that we were able to see earlier in the disease. That has been posed as one of the explanations. Scientists are trying to find out what else could explain this, and like I've told you, a lot of work is underway to determine how that looks like. What does it mean to have an African who has a comorbid condition and has gotten COVID? Is that different to Italians? Is that different to Americans? And there's a lot of studies underway in that regard, but we must maintain and we must remind you, our COVID, it is the same COVID that was there in Italy, that is there in China, same COVID. We have a good question here on importation of cases from Purity, questioning if we now have been able to define any imported cases after operating the airspaces. We do have a team, an integrated team that works with the KCAA and the airport authorities and MFA to look at our numbers of incoming passengers and outgoing passengers. What is important right now, perhaps, is not to really deal with imported cases, but to realize we have community transmission in the country. And if, on average, I think I saw in the last month about 14,000 entrants into the country, If 14,000 people came into a population of 40 million who already have community-transmitted COVID-19, it means that effect is highly diluted for that to be a cause of concern. And this is the premise through which globally countries agreed it was time to start opening up our borders. And so DG again will expound on this section. KEMSA issue, two-pronged question regarding the investigations that are underway in the COVID-19 fund. I'm well aware that the teams who are dealing with this issue are well appraised of their timelines, and I'm aware they are preparing their reports. And these reports shall then be forwarded to the necessary people for their consumption and then, of course, shared with the public. And so give time for this process to be undertaken. You'll be able to get the full reports and all the sort of granular issues that need to be answered. We still firmly, and I need to emphasize this, we still firmly invest and believe that KEMSA, by the very nature of it being a body that leverages on economies of scale, is adequate to be able to undertake the distribution of these commodities. Remember, KEMSA, if you think of it like an octopus, has networks to more than 6,000 health facilities in this country. In other words, a commodity stored in the KEMSA warehouse is able to get to almost 6,000 facilities in this country. That network has been invested in over years, more than 10 years in KEMSA, and that investment cannot be disregarded. And so, yes, that remains the agency. And I'm well aware, again, within KEMSA now, there's great transparency in mechanisms that will ensure these commodities are able to get to the health facilities. And KEFA here can give you assurances of the distribution list, and you can follow him and confirm that these things will get to the facilities that they need to get into. I think at this point I'll have Kasababu come in and comment on his question, and then we'll have DG really talk about this virus. Is it really different? And what more are we learning about this virus in Kenya?
Thank you. Thank you, Daktari Mwani Haemba threw a couple of questions at me. The first one is about the resumption of flights or the opening of the airspace between Nairobi and Dar es Salaam. And just to tell you and tell Kenyans that Kenya's foreign policy is about constructive engagement with all, is about good neighborliness, is about sharing prosperity and being there for one another. And it is in that spirit that we consider ourselves to be a good neighbor to all. And we consider Tanzania to be a friendly, brotherly, sisterly country with whom we definitely share a fantastic relationship. And we can assure you that we will continue to nurture and cultivate this relationship. We want to focus on the factors that make us stronger together. And we have such many factors between ourselves and the United Republic of Tanzania. And so we are happy that we can engage, we can interact through the airspaces, through our roads. And our assurance is that Kenya will continue to pursue that policy, that line of good neighborliness and constructive engagement. Now, regarding the consignment and where it is headed, I can assure you that we have full confidence in the capacity of government to not only handle this pandemic. And I think those of you who even watch global analysis, global news, you will know that Kenya has been highly rated amongst countries of the world in the manner in which the government of the Republic of Kenya has handled the COVID-19 pandemic. And we are proud because, as Chinua Achebe says, of the little lizard that jumped from the high Iroko tree, we must always be ready to also acknowledge what we have done right. And we have done it right in the manner in which Daktari, your team at MOH, has definitely done Kenya proud. And when we talk about KEMSA, my position, and this is a personal position, is that you must always draw a line between institutional capacity and personal or individual responsibility. And so if there are issues raised in respect of any particular individual, issues that are being properly investigated by the requisite agencies, that must not be commingled with the capacity of the institution and the responsibility of an institution which is in fact a statutory institution. And so yes, we have absolutely no doubt that as we hand these consignments, and we have received many of them, and will continue to receive more of them, we'll hand them to the Ministry of Health with the full confidence that they'll be put to good use. And however, these consignments or these supplies can never be too much. We cannot say now we have 6.2 billion worth of supplies. Now we should not enhance our capacity. We must have as much as we can manage to put together, because really we are dealing with a scenario that no one can accurately predict how long it's going to be with us. And so yes, we'll continue to seek support, we'll continue to build our capacity, and we'll continue to play, as Minister of Foreign Affairs, supporting role to the frontline ministry, which is the Ministry of Health.
Thank you, Kas Ababu. Now we have DG.
Thank you, CS, Dr. Mercy, Kas Ababu, and Member of Foreign Affairs. There was a question regarding imported cases of COVID-19. The Ministry of Health, working together with the Ministry of Transport and affiliated sagas under the Ministry of Transport, that is the Kenya Airports Authority, the Kenya Civil Aviation Authority, and the respective airlines, developed protocols to ensure that we open our airspace, because we had to balance between lives and livelihoods. And because of these protocols that we developed jointly and implemented appropriately, including public health social measures, mandatory screening at the ports of entry, and insistence on a COVID negative certificate before arrival in Kenya, and also guided by the WHO risk profiling of travelers. We have not seen any change in number of imported cases coming into the country. Of course, we also have a very stringent follow-up through our web-based platform. And because of this, there's no significant change before lifting the travel restriction and now when you have opened our airspace. And it is usually very easy when you are dealing with a public health problem to have people enter through a very, very restricted point of entry where you have control, instead of people coming through multiple points. So for us, people coming through Jomo Kenyatta International Airport or Mombasa, Moi International Airport, Mombasa, or Kisumu or Eldoret, makes it very, very easy for us to be able to focus on them and ensure that we do the appropriate follow-up. A number of cases asymptomatic versus asymptomatic, actually for our cases is 93% of our cases, or the 36,000 plus, have been asymptomatic, and only 7% exhibit any symptoms. And as Dr. Mwangangi stated, we postulate that this is because of our young population. Remember, like in Kenya, more than 65% of our population is less than 35 years old. The younger you are, the less likely that you are going to have a comorbidity like hypertension and diabetes. Compare this to Europe and the Americas, where you have a more elderly population, more people more than 60 years who are at a greater risk of getting a severe form of the disease, and of course with a concomitant comorbid conditions including hypertension, diabetes, and other cardiovascular diseases. This could have explained the reason as to why we have more people who have a milder form of the disease, and also we have a lower mortality. If you look at our case fatality ratio, it stands at 1.7 against the global average of 3.2. And it has been consistent at that figure for the past 3 or 4 months. And of course, going forward, as we get more and more cases of the COVID, our clinicians, the nurses, the doctors, our lab scientists, of course, they gain experience managing these cases, and therefore case management has also equally improved. Vaccine development, on Monday I told you that there are more than 180 candidate vaccines on trial.